Okay, so you want to talk German healthcare reform. It's a big one, right? We're diving into a proposed bill that's causing quite a stir, especially when it comes to how hospitals get funded and what it means for, well, all of us.
Yeah, it's interesting to say the least. I mean, Germany's healthcare system is generally well regarded, but this reform, it's aiming for a pretty fundamental shift in how things work.
Exactly. And we're not just talking about some vague ideas here. We're going straight to the source. Excerpts from the actual bill being debated in the Bundestag, plus some analysis to help us make sense of it all. So imagine, instead of hospitals getting paid for every single patient they see.
Kind of like a fee-for-service type of thing.
Yeah, exactly. They're talking about moving towards a system where hospitals get a more substantial fixed payment.
It's like that retainer you might have with a lawyer, right? You pay them to be available when you need them, regardless of how many hours they actually spend on your case.
That's a great analogy. So does that mean hospitals are just getting a free pass? Where's the incentive to provide really good care?
Well, that's where this whole Leistungsgruppen thing comes in. It's German for basically categories of medical services or specialties. The idea is that hospitals would focus on what they're best at instead of trying to be everything to everyone.
So instead of being a jack of all trades.
They become masters of one.
I like it. So give me an example. What kind of things are we talking about here?
Okay, so let's say you need a knee replacement. Instead of going to just any hospital, you would go to one that specializes in, well, knee replacements. They'd have dedicated surgeons, the latest equipment, and a proven track record of success with that specific procedure.
Makes sense. So they're saying, look, if a hospital wants to get paid for offering a certain license group.
They need to be the best at it. They have to meet very specific quality standards, have the right staff and equipment, and they even have to handle a minimum number of cases each year to show they really know their stuff.
So it's not just about having the equipment. It's about knowing how to use it effectively and consistently. This sounds promising for complex cases. But what about more general healthcare needs? Will general practitioners become a thing of the past?
That's the million-dollar question, isn't it?
And while we are on the topic of potential issues, what's the deal with streamlining administrative work? That was mentioned in the material.
Right now, hospitals are drowning in paperwork, spending countless hours on individual case reviews for every single patient. It's a system ripe for streamlining.
So less paperwork equals more time with patients. Sounds good to me. But this whole reform, it seems geared towards big hospitals and cities with all their fancy specialists. What about people in rural areas? How will they access care?
That's a huge concern, and the bill actually addresses this directly. They're looking at ways to ensure everyone benefits, regardless of location. Smaller hospitals in rural areas, they might struggle to meet those minimum volume thresholds for certain specialties, right?
Yeah, that makes sense.
So, to level the playing field, they're considering exceptions to the rules for these rural hospitals.
Okay, so they wouldn't be penalized for not having as many specialized cases.
Exactly. Plus, they're talking about dedicated funding to support these rural hospitals, making sure they have the resources to keep serving their communities.
That's reassuring, to say the least. It wouldn't be right if your zip code determined the quality of healthcare you receive. But let's be honest, this whole reform feels massive. Like it's not just tweaking a few things, it's a complete overhaul.
It's definitely a system-wide transformation, moving towards a more integrated and collaborative approach to healthcare.
Integrated. What does that look like in practice?
Think of it this way. Your care would transition seamlessly between different levels of the healthcare system. Need to see a specialist? No problem. Your general practitioner can easily coordinate that. Require a hospital stay, they'll have all your information, your medical history, everything ready to go.
So it's less about each provider working in their own little bubble and more about them working together as a team.
Exactly. And we're not just talking about better communication, we're talking about expanding the role of institutions that combine inpatient and outpatient services, making sure you get the right care in the right setting at the right time.
While it sounds amazing, getting everyone on the same page, sharing information, that takes work. A lot of it.
Absolutely. And it requires everyone to embrace this new way of working. Hospitals, general practitioners, specialists, everyone working together. Imagine a system where your medical information follows you, ensuring everyone involved in your care is in the loop. This could lead to more personalized treatment plans and better outcomes for patients.
It's like building a healthcare ecosystem. But let's be real. With big changes come challenges. What are we talking about here?
It's important to consider both the good and the bad. On the positive side, when hospitals specialize and meet these higher standards, patient outcomes could improve significantly. Think faster recovery times, fewer complications, a better experience overall.
So a win-win for patients in the healthcare system.
Precisely. Plus, this emphasis on transparency and patient empowerment. It could lead to a more engaged and informed public, encouraging people to take charge of their own health.
So what's the catch?
Well, a restructuring of this magnitude could lead to job losses, particularly in areas where hospitals might be consolidated.
Progress often comes with tough transitions. Anything else we should be prepared for?
One concern is that this specialization, while great for complex cases, could create disparities in access to specialized care.
How so?
Well, if certain highly specialized services are only available in major urban centers, people in rural areas might face longer travel times, longer wait times to get the care they need.
So it's like solving one problem but potentially creating another.
That's why those exceptions and funding mechanisms for rural hospitals are so important. It's a balancing act, ensuring the benefits of specialization reach everyone.
It sounds like this whole reform is a tightrope walk. How do we make sure it doesn't all fall apart?
That's where those built-in evaluation points come into play. It's about monitoring, gathering data, being willing to adapt and make adjustments along the way. Reform isn't a one-time thing, it's a process.
So be flexible, be responsive, and make sure the reform benefits everyone in the long run.
Exactly. This reform has huge potential, but success hinges on continuous learning, adaptation, and a commitment to making sure healthcare remains a right, not a privilege.
It's a lot to process, but this deep dive has been illuminating. You've laid out the potential benefits and the challenges with such clarity. Still, let's face it, predicting the future is never easy. We can analyze and speculate, but the real test will be in the execution.
It's true, predicting the future is always a gamble, but hey, that's part of what makes this so interesting, right? And speaking of interesting, there's one more thing from these documents. We should unpack how hospitals would be audited under this new system.
Okay, yeah, audits. Not exactly the most glamorous topic, but definitely important. I imagine with all these proposed changes, audits could make or break a hospital. So what are they planning?
Well, as it stands, hospitals are bogged down with those individual case reviews, right?
Yeah, tons of paperwork as we've discussed.
Exactly. It's time-consuming and takes away from actually caring for patients. This reform, it aims to change that. They're proposing a switch to a more targeted system.
Targeted how?
Think of it like this. Instead of checking every single item on a production line, you take a representative sample to get a good overall picture of quality.
So instead of reviewing every single case, they'll focus on a smaller, carefully selected sample.
Precisely. It's about working smarter, not harder. This approach could really cut down on bureaucracy, free up resources, and let hospitals prioritize what truly matters: patient care.
Sounds like a win-win. But could there be oversights? If they were only checking a sample, what if some things slip through the cracks?
That's the million-dollar question, isn't it? The devil's in the details. How are those samples chosen? What criteria are they using to assess quality? And what happens when they do find an issue?
So it's not just about picking a few random cases and calling it good.
Not at all. The specifics are still being worked out. The German Hospital Federation and the National Association of Statutory Health Insurance Funds, they're supposed to come up with a detailed plan based on recommendations from the Federal Medical Service.
It seems like a lot is still up in the air. So what's the timeline here? When can we expect to see these changes actually happening?
Well, this isn't a quick fix. It's a multi-year process with those checkpoints built in to make sure things are moving in the right direction. This gradual approach, it allows for adjustments along the way and hopefully leads to a more effective and sustainable system in the long run.
It sounds like this whole reform is all about balance. Progress with caution, bold steps, but with an eye on potential pitfalls. It's been fascinating to break this down with you. So for our listeners, what's the key takeaway? What should they remember about this German healthcare reform?
German healthcare is about to undergo a major transformation. This reform, if implemented as planned, will have a ripple effect on everyone: hospitals, providers, and most importantly, patients.
It's a lot to take in, but hopefully this deep dive has given our listeners the knowledge they need to understand these changes and how they might impact their healthcare experience.
Absolutely. Stay informed, engage in the conversation, and advocate for the healthcare system you deserve.
This has been quite the deep dive into the intricate world of German healthcare reform. We've gone from funding models and specialized care all the way to the nitty-gritty of hospital audits.
It's complicated, no doubt, but understanding these potential benefits and challenges is so important.
And on that note, we'll leave you with this final thought. This reform, it has the potential to make German healthcare more sustainable, more efficient, and more patient-centered. Will it succeed? Only time will tell. But by understanding the ins and outs of this reform, you're better equipped to navigate the future of your healthcare journey. Thanks for joining us.